First up is a person very well known to the EHE community. Lisa DeYoung is the Director of Patient Services with the EHE Foundation, and I'm lucky enough I get to work very closely with Lisa. She is a tremendous advocate for EHE patients. Lisa, in most cases, is the first person to engage with patients, and she always goes above and beyond to support them with their diagnosis. Lisa will be providing a quick spotlight on the EHE patient community. Please welcome Lisa.
Jenny, for that warm introduction, and welcome from the San Francisco Bay Area. As one of the founding members of the EHE Foundation, it is my honor to be with you today. Truly a dream come true, and one step closer in our mission to fight this horrific disease. I'd like to thank the Chan Zuckerberg Initiative for their generous support, in addition to my fellow team members and international foundation partners for their valuable contributions. I am filled with joy and enthusiasm as I represent the EHE patient voice and showcase the extraordinary patient-led support group. I wear a lot of hats, and for the last 6 years, I have welcomed nearly 1,700 patients, family members, caregivers, researchers, clinicians from all across the globe into our community, which often feels more like a family. I'm privileged to hold a position on the Sarcoma Coalition Steering Committee and was selected to the SARC Research Advocacy Council. These valuable collaborations enrich patient engagement and bring much needed disease awareness. Being an EHE patient comes with a unique set of challenges and obstacles, as we have heard from the patient testimonials. The combination of a high rate of misdiagnosis along with a prolonged diagnostic process leaves a patient weary and just overwhelmed. Yet they've just begun their journey. Our foundation has been able to dramatically reduce the lag time and expedite getting patients to experience care, which improve prognosis and overall survival. It shouldn't have to be this difficult for our patients. For many, the fear of the unknown steals their peace. Next slide, please. So here's a breakout of our community. It was formed in 2013 by a fellow EHE patient. We are fast approaching 2,000 members, and we're in 73 countries across the globe. And I've outlined the top 10 countries and how many members are in each group. So the bulk of the patients are here in the US. In addition, you'll see that this is predominantly female dominated by about 75%. And in terms of age demographic, it's in keeping with what other presenters have presented, ages 35 to 54, and both women and men are our top tier. Next slide, please. So what are we talking about on the page? We talk about a lot of things. Here is a breakout of the different categories. I've listed the top 5 symptoms that patients often report to me, but I also have a very long list, and maybe in the Q&A can explain that a little bit more. Fatigue is probably the #1 symptom when we meet for the first time that a patient will share with me. And then depending on disease location, it can also involve these other symptoms. Pain control is a huge hurdle for EHE patients, and most of patients report having better outcomes with anti-inflammatory agents versus opiates. Celebrex is probably one of the most commonly prescribed, And another interesting thing with pain is that when patients report increases in pain, that's often associated with disease progression or flare-up in EHE activity. We also have a large group of EHE patients who have other autoimmune disorders that I've listed. And in terms of disease location, because this is a vascular tumor that arises in blood vessels, I mean, it literally can be found anywhere. And one of the most unusual locations was a patient that reported it with it between her toes. We have some subgroups that have emerged over the years, in the last 6 years that we have been interfacing with the support group, and I've outlined those as well. Our community has been instrumental in participating in the McInnes trial, led by Dr. Scott Schutze at the University of Michigan. And in addition, our patients provide valuable data to a collaboration with the Netherlands on quality of life and symptom burden that Dr. Woodmia is going to talk about later. Next slide, please. Our research committee put together this reference slide. You can go to www.fightehe.org. You'll find a variety of support services and resources on that page. Also, an area that focuses on our research efforts with the EHE Foundation and the different programs that we have that we are launching this year. In closing, our active EHE group stands ready and poised to join arms with you in solving the many unsolved mysteries of this disease. Our community is focused on collaborative partnerships to further research, not only here in the US, but internationally. It is through these collective relationships working together, we will ultimately solve and cure EHE. Thank you for listening.
All right, thank you so much, Lisa. The EHE community appreciates the heck out of you.